Hi, Sister Kufrek Babel. How are you doing?
Fine. How are you too?
I'm fine and happy you were able to join me in this Zoom.
Okay.
So, I want to discuss some few diseases on congenital disease and disorder. Last year you taught me about these diseases, some of these diseases. So today I want us to share a little more about the disease. So I believe you still have some knowledge about what we're about to discuss. So I will share my screen. We are going to discuss three of these diseases. Then, please hold on while I share the screen with you.
Okay.
Okay. It did not appear here. Okay. Can you see it?
Yes.
Okay. So I will be reading the first case study and some symptoms and signs of the diseases. Then we will talk about it. So the first case study I would like us to talk about is single cell anemia. I believe you've heard about that before.
Sure, I do.
Okay. Okay, I will just read the case study, then we suggest the diagnosis procedure and the treatment plans. So now, please listen very attentively to the case study I'm going to read right now. It says, a young mother just gave birth an hour ago, and the obstetrician took the baby for examination of possible birth defects, and the doctor discovered that the baby has intense pain in the arms, legs, and abdomen, and also have fever. So the doctor suggested infant screening. So, like I said, what would you think is the diagnosis?
I feel since it involved the hand, the leg,
Mm.
and abdomen, when we are talking about the hand, the pain in the hand contains some bones. Okay. So I will suggest that is sickle cell anemia because sickle cell anemia has something to do with bone marrow,
Okay.
which will weaken the child's bone, and it will definitely affect the arms, the leg. In short, it destroys the baby blood cells. So I think it's sickle cell anemia.
Okay. You are very, very correct. That is the correct answer. The diagnosis is sickle cell anemia. And the diagnosis procedure is infant screening for at-risk patients. Then two is low hematocrits and sickle cells on blood smear. Then the treatment plan is follow replacement, symptomatic treatment, including analgesic and hydration. I believe you know what analgesic is a pain relief. Sure, you
Okay,
know.
so yes, I know. So you are trying to let me understand because this thing is when we are talking about sickle cell anemia, because
Mm,
I think I should have a little knowledge about that since
mm,
I'm doing health likewise. It
okay.
has something to do with hereditary. So either the both parents are sickle cell anemia, and definitely it will affect the child. Okay, one of the child or the children must be sickle cell anemia. Now, what can we do to stop this? What can we do to stop this illness?
Okay. As you can see, the prevention, there's no prevention for now. Okay. There's no prevention for now apart from the symptomatic prevention. Folic acid supplements, like that's what the mother's supposed to be taking while pregnant, and healthy diets, proper hydration, and also avoiding extreme temperatures or and moderate exercises. Those are the prevention
Okay,
treatment for now.
thank you very
Okay.
thank
And
you very
this
much.
this sickle cell anemia, if it is left untreated, it can cause serious health problems to
Yeah,
the
I
to
know
the baby.
that.
Yes, it can cause very serious health problem. As the baby is growing, you come to realize that the baby is having other serious symptoms of other diseases, very serious
Health
one.
issue.
And you will be visiting hospital oftentimes.
Okay.
Yeah,
So is it advisable, like when we are getting married, we should be so conscious about checking our blood group and genotype?
type very,
Because I
very
think,
important.
yeah,
Very, very
it
important.
involves it. So we can be able to prevent this happening to our children, because when we check and we notice that either the parent is SS or AS, we'll be able to avoid having a child that is
Yes,
passing through
yes.
there. And recently, one of my cousins died at the age of 23 years. She was sickle cell anemia. Okay, she died. It was painful. She reached the peak of age that she's supposed to enjoy what she has been suffering for. And that at that moment, she just dropped it. So it's something that instead of these sad events, I think we can prevent it by checking our blood group and avoiding this issue. Thank you very much.
Yes, thank you very much for that thought you shared with me. So we move quickly to the second case study. The second case study says baby Maria was born with hyperactive reflexes, red muscle contraction, and muscle weakness due to developmental defects of the brain at birth. So the diagnosis is cerebral palsy. You heard about that before?
Sure, I do.
Okay. So that's the diagnosis. And the diagnosis procedure is infant neurolo neurological assessment and physical exam and ultrasound, CT and MRI. So the CT is a ultrasound to like look at the body system of this child at birth.
Yeah.
So now this cerebral palsy, you see children born with weak muscles, like they can't walk, properly, like they're just weak. Then they don't um they don't have like they're not active even in school. They're not
Yeah.
active, they
Like
can't walk properly.
like some of them part of their body just come down
Yes,
and like drop. Okay, their muscle is weak. They can't
it's
stand.
weak, they can't
They are
stand.
just majority of them they are on wheelchairs.
Yeah, so now if you look at the diagnosis, you notice that all these things, like the ultrasound, the CT, and the MLR, will help the doctor, to know how they can help the child to at least function properly for some time, because this is it has no cure. The sickness has no cure, and the parents has to like be visiting hospital oftentimes also. It's not really easy for you to give birth to a child that's maybe instead of the child to grow up to be taking care of you, you'll be taking care of the child till the child grows. Oh, it's not
Yeah,
really
that one is
easy.
true. Yeah, it is. So, like we are saying, what are the possible prevention? What are the things we need to do to avoid this thing not happening again?
So I didn't get that. You said?
What are the possible prevention of avoiding this illness? What should
Okay,
we do so that we don't have children that have cerebral palsy?
okay. According to what I learned, I think the possible prevention is early prenatal care and good
So that
maternal
is
help.
when you know that you have taken, you need to be visiting hospital, you need
Yes,
to be going for checkup,
yes, you have to be taking your
you need to be
routine
going
routine
for
drugs during that pregnancy to protect that baby and proper delivery care.
yeah.
So this help a lot because you notice that some parents, whenever they are pregnant, that's the time they will start taking all these harmful substances. They don't care. Some they will just smoke, they will smoke, drink alcohol. All these things do affect the baby inside. That's why whenever one is pregnant, you'll be encouraged to eat vegetables, eat things that will help the baby grow well, and also
Well,
visit
thank you very
hospital
much.
for possible ultrasound to check and correct some things.
And also, I noticed that there are some women who like maybe deliver their children on their own, like
Yes,
delivery. They stay at home and do home delivery for their when they are pregnant. And this is part of the thing that might contribute to this illness because you delivering on your own, you are taking risk.
yes,
Okay. How my maybe develop some bone destruction or bone obstruction or anything, and it might affect the child as time goes on. So the
yes.
most important thing is to go to the hospital and go for proper delivery care, and then you know that you have a sound baby.
Yes, thank you very much. So we move
Oh,
to the third case study, which is cleft lip and palate. I can vividly remember you teaching me about this particular disease.
yeah, I did.
Yeah, you taught me about this particular disease, I think last year. So the case study says a mother gave birth 2 days ago to a baby with a hole in the middle of the roof of the mouth, and she was told that the baby will be undergoing a surgery. So now, like I said earlier, the possible diagnosis is cleft palate. Cleft palate is very, very common in children, especially the whites. They are born with this particular disease, and the diagnosis is physical exam. And can you share with me the treatment and possible prevention?
Yeah, while I was when I could remember vividly when I was taking you on this class, I was able to research about certain treatment that might be able for us to avoid this issue. We talk about prevention and treatment, and one of those things was feeding device, which that feeding device because the child has that hole, which will not be able allow that child to feed you very well. So that child needs that device to be able for him or her to feed well. Speech therapy, okay, employing somebody or maybe go to the hospital and maybe enroll that child, give a counselor to that child because opening that lip palate, that hole, it's always preventing a child to speak well. Okay, giving
Yes.
that child, it will give that impediment, not to the child to respond well when you are teaching or for him speaking. So he needs somebody to be able to guide him or her so that he can be able to speak and communicate very well. So most especially, especially surgery is the most especially. In short, here where I am, this rural area in my community, we are being exposed to this cleft lift and palate where their surgery is free. Okay, they make you to understand that when you give birth to this child and they discover this hole in the lift of that baby's mouth, you have to be giving a free surgery, giving that child a free surgery so that you might not say, maybe I didn't have money to take care, I didn't have money to do this. The surgery is very free. So that's the most important thing. Wherever you are giving birth to a child, you discover, just take it to the hospital and the hospital will give you a free surgery. So with this, it can help. And I'm also having a question
Okay.
because this normally happens to children, newborn babies. What are those causable factors that a pregnant women should eliminate in their life to be able to avoid this issue, to be able to give birth to a normal child? A child doesn't have this. What are those causable effects that need to be avoided?
Okay, I think like we said earlier, you said something from the very first start, okay? You said something about I'm just putting it general now. You said something about the genotype when we started with the sickle cell anemia, okay? AAs cannot marry AAs. AA should marry AA. Okay. So now to clip left, okay. What a mother should stay away from while pregnant or before pregnancy is to avoid smoking before or during pregnancy to avoid these diseases. There are a lot of things that pregnant women do that can affect their children, but they don't know. And it causes this disease, causes the children to born with these particular diseases. So now for them, for mothers to, stay away from this thing, they have to avoid smoking because it's from what I learned, I learned that smoking is the cause of cleft leaf or palate. Okay, then the single cell, we realize that marrying somebody that is not compatible with
But
your
since
genotype.
it's
Yes.
hereditary,
Yes,
it
it's
can be
hereditary.
transferred from the parents to the child.
Yes.
I think those things can be avoided.
Yes, those things can be avoided, like, so that the children will be born with um
A
good health.
normal child, a
Yes,
healthy child.
healthy children. Yes, exactly. So we have like there are lots of them. Okay, there are a lot of diseases that affect children after birth, like pyloric stenosis. There are also diseases, and some of these diseases does not have prevention. Okay, so for us to like stay away from all these things, as in we are young mothers, we've learned about this thing, we have the knowledge of it now. So for us to like stay away from all these problems, we need to avoid some certain things that need to be avoided during and after pregnancy. So, Sister Kufra, I don't know if you have anything to share again. You've come to.
No, there's nothing again. I think I've learned a lot today, adding to what I've already known. So
Okay.
I'm good. I am.
Okay.
Thank you
Thank
very
you
much.
so much. Like, I'm so grateful that you were able to join me on this Zoom and we talked and share a little more knowledge about some congenital disease and disorder that we know. We still have a lot of those diseases that we need to study and learn more about it. The treatment, the diagnosis procedure, signs and symptoms, and prevention and prognosis. Thank you very much for your time. And I
You're
hope to
welcome.
see you next week.
Of course. Bye-bye.
All right. Bye.